Hi, and welcome to another episode of Hot Takes with me, the Silver Fox, and more news from the Tavistock Clinic, that child sterilisation unit in London. One of the psychiatrists who worked there for 12 years has said that parents were bringing children as young as 3 to the clinic for reassignment, not because the children were transgender in any way, but simply because the parents wanted a child of a different sex. I mean, this is just appalling, isn't it? Now, we're going to take a look at this article, but it's just a shame that he didn't come forward some years earlier and perhaps saved a lot more children. But at least the truth is starting to come out now. And I'm hoping that eventually criminal charges will be brought. But let's look at this article. Right, this is the piece. There's a Dr. Az Hakim. He's a psychiatrist, worked at the clinic for 12 years. And he's basically telling the truth as it is. And it is outrageous. And it's terrible that this not only was allowed to happen, but that any sort of hospital or caregiving trust like this would be play so fast and loose, if you will, with children and their lives, their futures, everything. It's appalling. The parents of 3-year-olds took their children to the NHS Tavistock Clinic, claiming that they were trans, when they just wanted a child of a different sex, the psychiatrist says. Psychiatrist says Tavistock Gender Clinic was a transing factory for children. Now, I've said in previous videos on this that it really was, sterilising children on an industrial scale, and this just confirms what I've made claims about before, and it is horrific what was happening to these children. Dr. Az Hakim claims parents would falsely claim the toddlers were transgender, and he compared their behaviour he saw while working in the clinic to Munchausen by proxy. And the parents of children as young as 3 were fabricating stories that their toddlers were transgender, this former psychiatrist has claimed. Dr. Az Hakim worked at the controversial NHS clinic for 12 years until 2012, and said he expressed concerns that procedures followed by staff were mad, describing Tavistock as a transing factory. Now, that was between 2000 and 2012, and of course since then it's got even worse. And this push by the trans lobby is creating a massive overload. And like I say, and it's sort of gone like that, the numbers. So if it was bad 12 years ago, or 10 years ago, when he was there, think how awful it must be now. And there are zero safeguards for the safety of children here. So anyway, he goes on. You had 3-year-olds coming in. I saw these parents who had a son but wanted a daughter, or the other way round. The parents were saying, Johnny never looked like a boy, so we've changed his name and put on a wig, he said, according to the Telegraph. I remember saying to them, this is madness. What we're doing is madness. These are children. These are 3-year-olds. And there's Dr. Hakim. Hakim said that there was an overrepresentation of grieving parents who had lost a child only to become pregnant again. And he compared the behaviour of parents to Munchausen by proxy disease, in which a caregiver makes up symptoms in order to create the illusion that their child is sick. And it's called Transhausens by Proxy. So that's a good term. I like that. Transhausens by Proxy is what it is. And it's the parents wanting a child of a different sex, and so trying to convince themselves and the child that they're trans. But they're not. They're not trans. His comments come after it was revealed at least 15 children under the age of 4 were directed to the controversial clinic in the past 2 years. A similar number of 5-year-olds were referred between 21 and 22. The Gender Identity Development Service at the Tavistock Clinic, which is performing experimental medication on children in much the same way as went on in the camps in Germany during World War II. This is the level. This is the level that these people are at. Dr. Mengele would have nothing on these people. The NHS documents state that in total, over 5,000 children were referred to Tavistock service in the past 2 years alone, over concerns they were suffering from their gender identity not matching their biological sex. Only half of the referrals were for children aged 15 plus, which means half of them were for children aged 14 and below. They are having their lives destroyed, their futures ruined. They are being sterilised. Thousands and thousands of children. These monsters at Tavistock are, well, they're just monsters, aren't they? What they're doing is criminal. It's unethical. It's immoral. It's disgusting. The NHS data, unveiled among some new guidelines for how to treat children with gender dysphoria, only concerns referrals to the kids at Tavistock. Not all of the patients would have been taken for an actual treatment, which can include puberty blockers and hormones that help change their bodies to align more with their gender identity, but does nothing to change their sex, which is immutable. NHS England is cracking down on how children are referred to this care in the future, in the wake of the Tavistock chaos. This Tavistock Clinic has performed some of the most awful things on children, and nobody can speak out about it, because the moment anyone does, we've had nurses who've raised concerns, have been shouted down, threatened with the sack. They get abuse, they get threats from the trans community for speaking the truth, for protecting children. In what world do we punish people for protecting children? It is crazy, it is madness, and it should be illegal. Other mental health issues were overshadowed in favour of gender identity treatment, prompting accusations that staff rush children onto powerful medication. Yeah, what they were saying is, your child might be grieving, but it's not, it's gender dysphoria. Oh, your child might be facing bullying at school. No, it's gender dysphoria. Oh, your child might just be a bit depressed. It's gender dysphoria. That's how they were doing it. When you are a hammer, every problem is a nail. And they were just nailing children to the mast on this one in their rush to push this sick ideology. Under current guidelines, health and social service staff, teachers and charities can refer a child they think is suffering from gender dysphoria to a specialist NHS care. Not the parents. Oh, no. Social care people, teachers. A teacher can do this without the parents' knowledge or consent. What is going on? Why are we not protecting children? And this, quote, specialist NHS care is neither specialist nor care. These children are not fully assessed. They do not get any kind of psychiatric testing or psychological counselling. They are just gone in, have some tablets. Bang. We'll sharpen the knives and we'll whip your ghoulies off in a couple of weeks. That is what you're dealing with here. And who's saying this? A teacher, a care worker. Not the parents. Oh no, parents are the last ones to know that Johnny's become Joanna. Under draft rules published this week, which could be enforced from the spring, referrals to NHS gender identity care would be restricted to GPs and health service staff. Good, take it out of the hands of these other woke wankers. Stella O'Malley, psychotherapist and director of campaign group GenSpec, said the fact children under the age of 4 were being referred for gender identity care is shocking and concerning. It's frightening as well. Children up until the age of roughly 7 or 8 engage in magical thinking. For example, they can believe that thinking about something can make it real. And so can a lot of adults who become transgender, because they think if they pretend to be a woman long enough, they'll somehow magically become a woman. And that ain't going to happen. Very young kids who are gender non-conforming should be free to live as they please. Nobody should be responding to a gender non-conformity as a problem to be treated. The NHS estimates this change would slash referrals to the gender identity care by 5%, or about 250 children, based on latest data. And everyone you can save is a marvellous thing. And here's the sort of the timeline of events. Now, I've covered a lot of this before. Sue Evans, she wanted to speak out about it. She was threatened by the management, who threatened to fire her, but she also received threats from the trans community. And then in 2009, it became like the Soul Centre, and the number of people visiting it jumped, 10,000% or something ridiculous. Again, it's all this is basically just saying those people who wanted to speak out, who wanted to sort of report the problems that were going on, and they were getting threats. And then Hilary Cass's review that's come in now, and it's led basically to the closure, but not yet closed, it must be said, of this awful place. But they are changing the rules quite heavily now, because it is the worst thing really that's ever happened in the NHS. It is a scandal, and I do feel it's very important that anyone who was affected by this does actually sue now. And brave for him to come forward. I mean, it was 22 years ago when he started there, and he said at that time, as I said before, at that time there were very few children going there. But he's talking about 100 cases a year when he was there, and they're up to like 3,000 cases a year now. It's the destruction of children. It is awful. Anyway, I'm going to finish and come up. The Hippocratic Oath that doctors take says in part that first, do no harm. Well, these doctors are doing a great deal of harm indeed, and they must be made to pay. And if that involves a lengthy prison sentence, so be it. A message must be sent that you do not destroy the futures of children. And especially not at the behest of a social worker or teacher, with the parent not even being involved in the process. What the hell is going on? Now, I've stayed calm throughout this, and it's been very hard, but it would be too easy just to launch myself into an expletive-laden rant at the iniquities that were being performed here. We all know it's wrong. They must surely know it's wrong. But they're doing it because the very, very loud but very, very small trans lobby shout at them and call them ists and phobes, and they're scared of them. Well, they need to stop being scared of them. They need to be told, no, you are a danger to children, keep out of it. This is a purely medical matter. And at least that is starting to happen now. Anyway, I'm going to stop now. Thank you for listening. If you haven't already hit the subscribe button, please consider doing so. Ring the bell for notifications of future output. Leave a like, leave a comment, please share the video. And until next time, stay safe, stay well, make sure you are in control of your child's life. And goodbye.